Hello there. So in today's video, we want to look at data sources, and primarily if you're a beginner and you're trying to figure out what kind of data should I use to do my projects, especially early on, and you want to get that hands-on experience, I would personally recommend these sources. So to begin with, let me just open this tab, and the first place you want to start with or start from is WHO data. So when you key in WHO data, it will bring you to this page, and where you want to click first is the Global Health Observatory. So this is like the data gateway to the data repository for WHO, and once you open it, it gives you data in forms of indicators and countries. So when you look at, for example, indicators, you get a whole list of indicators that are available, and these indicators might be in tune to the area that you like looking into, or the clinical niche that you are interested in. So just from the top of the list, let us look at hepatitis. Let us click hepatitis new infections. You are able to see that we get this window. So let it load. Yep, let it load. It's gathering global data. So the importance here is that data over here will be secondary data. So that means that obviously it's not primary data that has been aggregated from different countries. Now, different countries upload their data to WHO, depending on how frequent they collect the data, but mostly it's normally after 1 year. So in this case, this is what this repo gives you access to. So for example, you can see here we have export data in CSV format. So I think if you right click, let us say open new tab. Yeah, there we go. The data is downloaded, and here you go. Here's an example of the data that is downloaded. You can see, and you can explore this. All right, great. So now let us look into something else. So now let us even you can explore the metadata. For example, it goes further to explain what the indicator measures, the definition, the disaggregation. So I said by country and WHO region in this case, the method of estimation, and it goes on and forth. All right. So next place you want to look for data is World Bank. So World Bank data, World Bank open data. So World Bank also has data, and more so it will be closely related to WHO, but they have a more inclination to policy kind of things, socioeconomic kind of data. So if you are trying to get data richness in terms of socioeconomic variables and those kind of stuff, World Bank is the first place to start with. So this is the World Bank data and resources page. So the link is here. I will also attach the link in the description. So for example, if I click datasets, let's see what pops up. A cross-country database of physical space, adult population survey, African registry indicators. So there is quite a lot. It will slightly deviate from health indicators from the way we saw from WHO. So from WHO, you can see the indicators are primarily within the health domain, like STIs, global dementia, oral health. But when you come into World Bank, you see it cuts across other domains as well. So I also saw, for example, data on population, adult population. So if you come into this filter section, I think you can get more on health if you're interested with health. So let us see, let us play around with it. Let us go to all in all. And you can try and get what area that you find that it's most interesting to you, and you can filter over this site. So I also believe there is the World Bank World Bank Health data. So let us look at World Bank Health data. So when you click at World Bank Health, it now goes specifically towards the health indicators. So you can see in this column, we have adolescence, fertility, age dependency, birth rate, cause of death. So let us say cause of death by non-communicable diseases. When I click that and I say CSV, I'm able to get a CSV file. So for this, you just have to, let us look at it. Just have to open it up, and there you go. We have data, goes all the way. So this is not that much populated, but you can see an example of how to get data. So this is also per country. So let us look for a region that is much populated. So we can have hospital deaths or hospital beds, sorry. So this is not populated over this side. So again, this is still country level data. It can give you some insight on what data is available there per country. So you can see most of the data is available from the year 2000. So that's the second data source. The third data source that comes into mind is HDE. So this is humanitarian data. Here it is, humanitarian data sets. So humanitarian data sets, HDX, it's also part of WHO. So WHO also has this repository that looks into humanitarian data. So maybe if your program, if your project, has something to do with the World Food Program, you can get data that is country specific again in this database, and you can explore with it and get your data. So practical data over here is free. So depending on how much you want to look into, whatever you want to write, not necessarily things to do with coding, can be even a report that you need to generate, can be even insight that you need to get from a data point of view. This is one place to get it. So that is WHO, number one. Number two, I've looked at World Bank. Number three, I've looked at HDX. Number four is OECD. So OECD database. So OECD has a data explorer. Let us look at the data. So OECD will look at countries within Europe. So I know there's a chain of countries who have some certain economic policy or economic, let me say, agreement. So that is the countries in which OECD focuses on. So the good thing is that these countries release data sets and comes with policy that is available for the same. So it's a good place when you're trying to think about policy and data and seeing how one affects the other. There is extensive documentation in OECD. Again, the data level is still country level, but it gives you insight on how important this data is. So the good thing with OECD is not only limited to health. It has health, economy, tax, regional, rural and urban development. So let us click, for example, on health. You can get an overview of what the data looks like. So let us see hip and knee patient-reported outcome measures. Let's open up. So again, the data is here. Let us see if we can get some tables. It gives you the data set of these particular countries, well documented over these years, and you can use this to do some analysis, or even just to extrapolate, or even just to pass an idea like, hey, this is available in this set of countries. Can it be done across Africa? Can it be done in Kenya? Something like that. So that's number four. We've looked at World Bank, we've looked at WHO, we've looked at World Bank, HDX, and now we have OECD. So again, if you want diversity, if you want data set that is more inclined towards policy, check out OECD. I love their policy their policy outlook. It's normally very rich. So, okay, here is the data OECD Data Explorer. So you see the data sets are across this region. So when it comes specifically to health, there is quite a lot. So let us look at, for example, the pharmaceutical market. You can get some data on, anything. So I'm just clicking at this point just to see what kind of data is available. All right, again, so you see over here, there's quite extensive data sets that gives you insight on what's happening. So you can use this data set to model, you can use this data set to just pass on an idea, write a policy, make up a write-up, and do whatever you want to do. So the last bit I want to look into is my favorite, IHME. So let me just click this. So IHME on the other side is a little bit complex, especially on how you go about it. So this particular source of data, again, is still country level, but they do it in some sort of modeling way. So, for example, in those previous datasets you saw, in some years they had gaps. So with the HME, what they do, they use mathematical models to fill out these gaps, and this becomes helpful because it helps you do some proper analysis, proper modeling, proper estimation of costs, of how healthcare is, and all that kind of stuff, mortality rate, what else, incidence rate. So let me just come into this panel. So I love their search query panel. So for example, if I come to GBD estimate, you can see there's a number of things that you can look into. You can look into risk factor, etiology. Let me just click on probability of death by cause, for example. Or let me just go to one of my favorite. Now let me see, which one do I love here? Cause of death or injury. Let me just get that. So you can look at the measures. You can select any. I like going with prevalence because most of my analysis begin with prevalence. I want to know what is happening in a particular country or with a particular condition, and then you can choose the metric. Either you want to look at it by number, percentage of rate, location. I want to go global for now because it will pull up many countries. So I can say Kenya, and you can see it goes down to county levels. So obviously it won't really be that accurate, but the estimations with which they use, it's quite impressive. So it's somewhere that you really want to start with. So Tanzania, I can say Uganda. Great. So all ages, sex, both, the didn't search. So you see the datasets are here, they're available, and then you normally download with here. So with IHME, what you do, you have to create an account, which is again free. Once you create an account, when you press download, what it does, it sends the link to your email. So that way you can download it from your email. So you can see you will receive an email when your downloads are ready. You can also monitor progress here. So let me just switch the window to my email. So as you can see, it is here. Thank you for your interest in global burden of disease, GBD, for using a results tool. Here is the data set from IHME. So if I click, let me just click, yep. Here are the results. It will pop up, yep. Sign in to view download. So I can sign in to view download. So I'll click there. It has my details loaded, so I'll sign in. Sign in succeeded, and there you go. All right, so there are the countries that I wanted: Kenya, Tanzania, Uganda, and here are the values. Okay, so that's just a brief overview. If you take your time and explore these 5 sources, it will take you almost forever, but it's a good place to start from. If you explore it more, you'll probably find some cool, interesting visuals such as this, so something they can easily come up with. So those are the 5 sources. Number 1, WHO. Number 2, World Bank. Number 3, HDX. Number 4, OECD. And number 5, IHME. All right, great. See you next time. Bye-bye.